Hello, my name is Gail Baxter, and the purpose of this video is to demonstrate a central line dressing change. Before beginning the procedure, you need to review your hospital's policy and procedure manual. Next, you need to complete the initial protocol before starting the procedure. You need to verify the order, identify your client, his wristband is right here, introduce yourself, explain the procedure, assess your client, gather your necessary equipment, which would include your central line dressing kit, a set of non-sterile gloves, and an extra mask for your patient. Next, I would wash my hands and then adjust your bed. Now, for the purpose of this video, the patient's head of the bed is elevated, but when you do the procedure at your institution, remember the patient's head should be completely flat. And next you would put down your side rail. Okay. And you would need to turn your patient's head away from you, away from the dressing. Okay. Remember, once again, when you're actually doing this on a patient, the head of the bed would be flat. And next, I would provide privacy. Next, I'm going to apply the mask to the patient. And remember, the patient's head is still turned towards the left, away from the dressing. Next, I'm going to remove the old dressing. I'm going to put on the non-sterile gloves. Okay. And I'll start removing the old dressing. You need to start lifting up the four corners of the old dressing. And the object is to remove the dressing towards the center, towards the insertion site. And you must be careful not to dislodge the catheter, so you need to anchor it with one finger while doing so. And I will remove the old dressing and gloves together and place in receptacle at the bedside. Okay. Next, I need to inspect the catheter insertion site to make sure there are no signs and symptoms of infection, which would include any redness, swelling, or drainage. Next, I will prepare my sterile field. In the package, you will see that there is the ChloroPrep, the mask, a set of sterile gloves, and a dressing. First, I'll put on the mask, but for the purpose of this video, I will leave it off so you can hear me. Okay. Next, I will put on the sterile gloves. Next, I will apply the ChloroPrep. Now, you pinch it in order to let the fluid go down to the sponge. When you do, you'll hear a snap. Next, I'll just want to keep my finger on the catheter as to be careful not to dislodge it while I'm cleaning the area. When you place the sponge down, you need to scrub in a back and forth motion for approximately 30 seconds. So I'd press and just go back and forth for approximately 30 seconds to clean the area. Next, I'll apply the dressing. I like to apply it lengthwise to cover the insertion site and part of the catheter up to about the hub. Now, normally you would not lift it, but for the purpose of this video, I will show that these two holes, that's normally where it will be sutured into the patient. Next, we'll apply the dressing. So you would place it approximately like that. You start from the center and make sure it's occlusive in the center first. So you start from the center and then work your way out to the four corners. Next, you can remove the white piece. Okay. And this piece is where you can time, date, and initialize your dressing. So after you have done that, then you can just place that on. Okay. Next, I will take off my gloves and my mask and the patient's mask. Next, I will put back up the side rail and adjust the bed for the patient's comfort. Remember to document your dressing change in the patient's medical record and be sure to include the date and time of the dressing change and your nursing assessment of the insertion site